Hey everybody, welcome back to my YouTube channel. So in today's video, I'm super excited to record it for you guys because I'm going to be recording a clinical day in the life of a nursing student. If you all already didn't know, I'm currently a senior nursing student at the University of Pennsylvania. So right now I'm completing my senior practicum or senior preceptorship in the NICU. From the beginning of my nursing career, I knew that I wanted to be in the NICU, so it's kind of just crazy that I'm actually here and I feel like how I expected to feel about the NICU. So I'm really excited to record this video for you all. As you guys kind of saw, this is just my morning routine. I like to get up a little bit earlier to, just make a cup of tea, cut up some fruit, and set my body right, get ready for the day, basically. It can be hard to get up in the morning sometimes, so this just kind of helps me to get up, get ready to do whatever I need to do. During this time, I kind of also like to set my intentions for the day, set my, body, spirit right, to have a good, successful day. But yeah, you guys, if you haven't already subscribed to my channel, definitely make sure you subscribe because I have more nursing content coming soon for you guys. And if this is something you're interested in, you definitely don't want to miss out on anything I post. And I also have a bunch of other, other videos on my channel, other things that I like to do. So definitely be sure to subscribe so you can see everything. I'm gonna just finish my morning routine and finish getting ready, put my scrubs on, and I guess I'll see you guys at the hospital. Just a quick midday check-in. I'm on my way to Starbucks because I like to get some caffeine to just keep me going, keep me up. I have to update y'all on what I've been doing. The caffeine is secure. This is a matcha latte. It's natural caffeine. I'm telling y'all, it's a matcha latte with vanilla, cold foam, oat milk, brown sugar, syrup, and matcha. This hits. Alright, so I am currently at lunch. I don't know why I look like this. But yeah, I'm currently at lunch. Today's been going really well. For me, I only have 2 patients, and they're pretty stable, so today is hasn't really been a hectic day. So I'll update y'all on everything when I get home, run through their diagnosis and what I kind of did today. I feel it's really hard to record stuff because I'm in a hospital, so I can't really show y'all exactly what I'm doing. I definitely will explain everything at the end of the day. But like I said, today has been going really well for me. I've been trying to exert my independence and really take over in terms of doing all the care and stuff. So I feel I've really been able to do that. It is 2 o'clock. I have another feed that's due at 3, so I'm gonna probably be back 2:30ish. I always try to find the good times where I won't be doing something for a whole hour and get everything done, all the documentation, assessments, feeds, anything that I need, so I won't have to worry about all that stuff when I'm actually on break. I didn't end up packing a lunch today, but I'm glad that they ended up ordering from Sabrina's Cafe. So I just got me a little turkey sandwich. It's really good. I'm gonna finish enjoying my lunch, and I'll probably see y'all honestly when I get back home. And like I said, just update y'all on everything and let y'all know how my whole day went and what I did today. So I've made it back home. I want to give y'all a rundown of how my whole day went. I tried to get as much content as I could, but like I said, I'm in a hospital, so I feel I can't really record much. I definitely still want to go through my whole day and kind of what I did today. I'm not in my scrubs anymore because I just like to take my scrubs off immediately when I get home because the hospital is low-key one of the dirtiest places. You would think it's really clean, but because it's so much going on there, it's it's actually kind of dirty. But yeah, I really just like to like take off like all my scrubs and just kind of settle down. So I want to run through my day with y'all. I feel like this depends on which nursing school you're at, but this is, like I told you guys, this is my last clinical experience, so it's my senior preceptorship. And in this clinical rotation, you pretty much want to like exert your independence and take on like half of like your preceptor nurse's assignment. It's definitely a different type of clinical than any other clinical that I've done like in my nursing career. But yeah, so like I told you guys, I'm in the NICU. When I actually get to the hospital, I like to check the assignment board because they'll usually have, you know, like my name, what assignment I'll be at for the day, like what beds, and then like which nurse I'll be working with. I check the assignment board and then I go to my room. That's when my day starts. So I'll get a report from the night shift nurse with my nurse preceptor. I like to just like grab some printer paper and like pretty much write everything down. I'll like insert some clips of like what my assignment papers look like. I can't really show y'all too much because like I write everything, but I'll like show y'all what I can. But yeah, so I get a report from the night shift nurse, and pretty much like that just consists of like writing down, you know, the patient's demographics and like what their admitting diagnosis is and like why they're actually in the hospital and like any history of events that happen. You also like go through systems, so like neuro, cardiovascular, respiratory, all those systems. Tells you like what was going on with the patient for that shift. After I get a report from the night shift nurse, I like to go into the actual chart and kind of just like write out the most important information that I'll need like for my shift. Everybody does it differently, but what I like to do is I like to write out my orders, and I don't write out every order, but I just write out like the important orders, like if I have anything due, like labs or any like scheduled diagnostic tests, like x-rays or like ultrasounds. I also like to write down anything that is ordered that's like important, like that can be like feedings, like certain ways that you have to feed or certain ways that you have to position the patient, you know, just whatever it is. And I also like to write down LDAs, so that's like lines, drains, and like airways, something. They have like an IV, any airway devices like nasal cannulas if they're intubated. They have any tubes like an NG tube or a G tube, stuff like that. Also like to write in for rounds, and I pretty much like leave that blank. Rounds usually happens like around the morning. You'll have like the nursing team, which is like in the NICU it's the neonatology team, and they'll like come around, they'll like round on the patient and basically see like if there's anything that needs to be changed in like their plan of care or like their orders. Also do like an hour by hour plan of like what I need to do. So I'll write down literally 8 o'clock, 9 o'clock, 10 o'clock, 11 o'clock, like every hour of my shift. And then I go in and add when I'll do my assessment, if I have like feed, if I have like any medications due, just like anything that's like kind of scheduled or like what I know I need to do. Then I honestly start my day. One thing I will say is organization is so key in nursing, especially working in an intense and critical care unit, because things can definitely get hectic, and like when you're organized it just makes things so much better. And you just like, even when stuff hit the fan, you like, okay, it's cool, like, you know, I know what I need to do, I got it, like, you know what I'm saying, you have everything kind of like laid out for you. So I definitely like to start my day off by being real organized, real kind of like detailed in the most concise way, because you don't want to spend like a whole hour on like writing out, you know, everything. You just want to like really get like those key things together and really just know what's going on with your patient. So after I like set up, you know, my like plan of care for the day, I actually go in and just like assess the environment and assess the patient. So in the NICU, we like to do like safety checks in the morning. So that pretty much just looks like, safety checks is basically making sure that if there's an emergency that happens, that like your patient will be able to be okay. So it's making sure you have like that emergency oxygen on deck. In the NICU, it's really nice because they low-key have everything like already put out for you, like your emergency medication list. They already have like every dosage like tailored to your patient. You don't have to like actually go through and like try to figure out, like, you know, do the calculation, try to figure out exactly how much medication they need. Like, it's already there in the list. Also in safety checks, just like to like look at the patient, make sure they're good, just kind of like overall look at like what they got going on. That's why I said the LDAs is really important, so you can know like which lines, which drains, which, you know, everything that's going on with them. So just airway device, like checking to make sure that like that's straight, like that's doing what it's supposed to be doing. Also like checking their IV lines, like tracing it back to the pump, making sure it's like the right rate, it's the right thing that's going, and it's in the right place. And yeah, that's pretty much what a safety checks looks like. After that, it's honestly depending on each patient and what's going on. But the rest of the day looks like just like doing an assessment, doing feedings in the NICU. Like regularly, the feedings are like every 3 hours, and it usually starts at 9, but it can like change depending on like the patient. And then just anything else that's scheduled, like medications or anything else you need to do. So for my specific patients, my day was like it was pretty relaxed. Like it wasn't too much going on. I had 2 patients today. So my first patient was an EA, which is an esophageal atresia. And basically, my nursing people, y'all don't know what I'm talking about, but I'm gonna try to explain it in like the best, you know, basic terms. So you have like an esophagus, which is like the tube or the connection that like puts things in your stomach, and then you have your trachea, which is basically like your windpipe or your airway. And so with esophageal atresia, your esophagus is disconnected. So you have like one part here as your esophagus and then another part here, and it's just like a space in between them. Pretty much with these patients, it's really important that they get a surgery for it, because like I said, your esophagus goes to your stomach, so all of that like saliva and just like extra secretions or anything that goes in your mouth in EA is pretty much stuck in a pouch. So once that pouch fills up with all that saliva and fluids and everything, it can basically almost like drown you if, you know, those fluids aren't taken out. What happens in the NICU with EA, just want to wait until like they grow enough and their esophagus grows to where you can connect them in surgery, and then just monitor them like after surgery to make sure, you know, that track is working, that there's no perforation or anything going wrong with it. For the patient that I had, they had a calibration, which is basically a test to see like how far apart the 2 segments of the esophagus is. It wasn't close enough to where they could connect it, so they're still waiting for the baby to grow. And so for care, it was honestly just monitoring their proposal. I'll like insert some pictures too that I can find like from the internet. Proposal is basically like a suction tube. So it suctions out all those like extra secretions and everything. They can't be put into the stomach. On our shift, we were like making sure, you know, the patient's proposal was functioning properly and just doing like all other regular care, which is, you know, just diaper change and vital signs whenever it was needed. The thing that happened with this patient was that their proposal wasn't really functioning as properly as it should. So the patient was kind of like, you know, in kind of like uncomfortable. What was decided was to like up the size of the proposal device. So just basically make the diameter a little bit bigger so it can be like more space for those secretions to go up, because sometimes they can be kind of thick and get stuck, especially if they're in a tiny tube. So we just changed the proposal and was just monitoring the patient, making sure that they were doing all right with that change. The patient was pretty much okay, but definitely was some adjusting that needed to happen and just a little extra care. So that's what we did with that patient. And then my other patient, I have to look at my notes for this patient because this is like a new diagnosis for me. My other patient had prenatal findings of pyelectasis. I believe that's how you pronounce it, pyelectasis. And basically that's where there's like extra fluid in the kidneys. That can be concerning because it's like kidney infection, kidney disease, or just like overall like urinary issues. They were definitely gonna like, you know, monitor the patient like after birth and make sure everything was okay with them. After birth, they were like found to have hydronephrosis, which is basically like just like swelling in the kidneys. For this patient, it was honestly just doing like regular care, except we were definitely like waiting like for just different diagnostic tests to like see what was going on. So like different ultrasounds of like the abdomen and the bladder, and also like x-rays. The patient also had like some GI issues. They couldn't PO feed, which is basically like feeding by the mouth. So they had like some episodes of like emesis, which is like throwing up. When that happens, put patients on TPN, which is parenteral nutrition. So it's basically like everything that you can't get from feeding goes straight to like into your bloodstream, and you get your nutrition that way. And so that's what this patient was on. And yeah, we're just like monitoring their GI function, their renal function. Like the patient had a urinary catheter, so just checking that and making sure everything is okay with that. But yeah, that was pretty much like my day. I really had like a good day today. Like I said, this is like the time for like me to like really be independent and like learn as much as I can, because I know that I don't want to be anywhere else besides the NICU. So I'm definitely like taking the opportunity to like learn literally everything I can. Like I look up all the different diagnoses. I want to know like exactly what the diagnoses mean. I was able to like interact with the patient's families. Like both of the patient's families were at the bedside, and like help them out, make sure they're good. Yeah, that's pretty much my day. Like I documented everything. I did like all assessments, all the care. Like I was, you know, I'm really in that role. Like technically at this point I feel like I'm basically like a nurse. Like like I'm basically a nurse, I feel like, honestly. But yeah, I had like a really good day. Today was like more like a chill day for me, which I actually appreciate, because in the NICU I feel like it honestly depends. Like you can have like a real intense and like critical patient where you only have like one patient and it's just like you like on your feet all the time, or it can be like kind of like how today was for me, where it's like you have two patients, they're both kind of like stable, they might have some little things going on, but for the most part they're good, and you just, you know, doing care and interacting with them when you can. For the rest of today, I'm honestly gonna figure out what I'm eating for dinner and just relax. You know, 12 hours is a long time to be doing anything, but especially to be like in the hospital and working. So I definitely just like once the shift is over, I take my time to relax. Like I'm relaxing, I'm chilling for the rest of the day. This pretty much like completes my clinical day as a nursing student in the NICU. I really hope you all liked this video and was like able to learn something. I'm really trying to like, you know, give y'all as much information as I can, because I feel like, you know, when like looking or like researching about different like jobs or careers or like wherever you want to do, it sometimes can be hard, especially for like hospital jobs, because like it's something that people don't talk about or you don't know about unless like you have, you know, somebody in close proximity that's like doing that. I definitely want to, you know, help y'all out and like let y'all know what it's like to be a nursing student, but also what it's like to be in the NICU. Definitely leave a comment down below letting me know, you know, if you're in nursing school or if you're thinking about being in nursing school and like what area you might want to work in. You can like let me know if this video helped you, whatever. I really like to like, you know, read y'all comments and interact with y'all. And also comment down below if you would like me to record like more nursing content, because I definitely can do that for y'all. Like I said, I'm a senior in nursing, so I feel like I'm a little bit more established in my nursing career. So like I have an idea of like pretty much, you know, all that has to do with like nursing and nursing school. So if you have any questions about nursing, leave them down below and I can possibly, you know, answer them or like record different videos. And if you haven't already subscribed to my channel, like, I don't know what you're doing, you know, definitely subscribe to my channel, because definitely have more nursing content if that's what you're into. I also have like other things that I do on my channel that you can definitely go ahead and check out. We continuing to build a community over here. I'm so thankful for each and every one of you who has already subscribed to my channel. So if you haven't already subscribed to my channel, go ahead and make sure you subscribe. I really hope you all learned something from this video, and I hope you guys have a great rest of your day. Thank you guys for watching this video, and I will see you guys in my next one. Bye.